Hi, welcome to the University of Pennsylvania's residency program in family medicine and community health. I am Amy Holland, one of the family medicine physicians here at PHMC Cedar in partnership with Penn Medicine. We are located in West Philadelphia on the Cedar campus of the University of Pennsylvania. Right now, I'm standing outside our newest residency clinic site. Come on, let's take a look inside. After me. The PHMC Cedar Clinic is a new clinic as of November 2021, serving primarily residents of West Philadelphia. The office will serve as a secondary residency training site for our residents, particularly those who are interested in community medicine. And now I'm going to turn things over to my colleague, Dr. Van Niekerk, one of my fellow family medicine physicians.
Hi. A majority of our patient population is insured. However, we do see an uninsured and an underinsured population as well. We're also serving the Penn employee and PHMC employees who work within the building. Our patient volume is continuing to grow, seeing about 500 patients per month. We're also attempting to grow our pediatric and our prenatal visit population.
As we leave the room, we go directly into the team room where we'll mostly be with you precepting and where the physicians spend most of their time charting and pre-charting and working with our nurse to help us with anything from triaging to prior auths to release of records and helping us fax and order all of the medications and the vaccines that we need. This room is where our fabulous MAs work. The MAs are helping us obviously to room the patients, but they can also, once the patient is done with us, they help with immunizations, and each of our MAs is able to draw blood. These services are all on a sliding scale fee for our uninsured and underinsured patients. As we walk down to the privacy room, the room where you'll mostly be spending your time, this is going to be our resident workroom where you'll be able to pre-chart and chart on your patients. This is also where we'll have morning didactics together. As we walk back down the hallway on your left, you're going to see each of our rooms is a pretty good size, so they can all be used as procedural rooms. Each of the family medicine physicians who are working with you, who you're going to be working with, have a pretty broad scope of practice as far as procedural medicine goes. One of the massive benefits to being in our clinic is that we also have a behavioral health consultant that's full-time with us, so she's able to bring patients back and do therapy sessions in her room. She's able to see patients before or after our visits whenever is necessary. This is our team break room where we'll have lunch together, and this is our triage room where our MAs and our nurse as needed can bring patients back, get blood draws, and help decide if a patient needs to be seen right away, as we do see walk-in patients. Because our clinic is situated within a large campus, we do have internal medicine services where our patients are being referred from. We also have a large ED where we're getting patients referred to us and where we've been able to send patients down very seamlessly. As a resident at the Cedar site, you'll also have the ability to rotate through two of the PHMC outside programs. The first is Interim House West, which is one of the few residential substance abuse treatment programs that provides substance use treatment and housing for 20 women and up to 45 of their children at any given time. West Haven is the other program that residents at Cedar would be able to rotate through. This is a long-term structured living that serves people with significant mental health illness. There is on-site psychiatric care, but we would function as primary care for the site. By far the majority of the people who live in our neighborhood are Black Philadelphians, and we are acutely aware of the impact that generations of structural racism have had on the health of our patients. Because we're functioning within a community health center, we do feel that the training that you will get here will be able to give you a better understanding and appreciation for social determinants of health, and understand a little bit better the resources that are needed to really help with the constant progress towards health equity in West Philadelphia.